Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to speak about tennis elbow. The medical name for tennis elbow is lateral epicondylitis. You may also hear it called lateral elbow tendinopathy and forearm extensor tendinopathy. Now I want to go over the anatomy real quick so that you understand exactly what these terms mean. When we speak about the body, the anatomical position is with the palms forward. The arms are down by the sides and the palms are forward. So if we look at the forearm, this is the anterior, this is the posterior, this is the medial, and this is the lateral. So if you have your arm down by your side, the lateral side is the part that is facing outwards. So lateral epicondylitis is pain that occurs on the outside part of the elbow. The lateral epicondyle is part of the humerus bone. You have muscles that extend the wrist that attach to the lateral epicondyle. Wrist motions are flexion, extension, ulnar deviation, and radial deviation. When we speak about lateral epicondylitis, you have to realize this is a repetitive strain injury that occurs from repetitive wrist extension and forearm supination and pronation. Forearm motions are supination and pronation. So lateral epicondylitis is a repetitive injury, an overuse injury from repetitive wrist extension and forearm supination and pronation. I wanted to go over those motions and those body positions so you understand a little bit better what I'm speaking about in today's video. I am going to use the name lateral epicondylitis throughout this video. Tennis elbow is just a nickname because that is the most familiar sport that this injury occurs during. It can also occur during any type of racket sport. It can also occur during weightlifting and also just from constant gripping motions. Lateral epicondylitis is also common in golfers. If a person is a right-handed golfer, usually lateral epicondylitis occurs in the left side. Medial epicondylitis, which I already spoke about in another video, is nicknamed golfer's elbow, and that occurs on the medial side. But today's class again is on lateral epicondylitis, which is common in tennis and all types of racket sports, in weightlifting, and in golf. Lateral epicondylitis is more common in the dominant hand, and like I stated before, it is nicknamed tennis elbow because it is so common in tennis players. 40 to 50% of tennis players will get this condition at least once in their lifetime. It usually occurs because they are performing a single-handed backhand stroke repetitively. Remember, lateral epicondylitis occurs because of the wrist extension. The muscles that extend the wrist attach at the lateral epicondyle of the humerus. These muscles become inflamed because of the repetitive usage. The tendons where they attach at the lateral epicondyle start to become inflamed, and this condition, once it occurs, if not treated properly, can become a chronic condition. Lateral epicondylitis is one of the most prevalent disorders in the arm. The symptoms of lateral epicondylitis include pain and burning at the lateral elbow just distal to the lateral epicondyle, and if the pain continues, those symptoms can move down into the muscles that extend the wrist. It is usually aggravated by active and resisted wrist extension. Pain and tenderness elicited upon direct palpation, meaning putting pressure on the lateral epicondyle, the radial humeral joint space, the common extensor tendon, and the proximal forearm extensor muscles is a hallmark of lateral epicondylitis. Grip weakness, including pain and difficulty shaking hands, pain with resisted wrist extension, and then also resisted middle finger extension when the elbow is straight. Grip strength is usually reduced. This condition has an insidious onset, meaning that it comes on slowly and then increases in intensity and frequency as it continues. It also has a slow progression of worsening symptoms, but it definitely progresses if you're not modifying your activities and you're not seeking professional care. Lateral epicondylitis is an overuse injury. With any type of overtraining injuries, the person is training beyond the body's ability to recover. So you have to think about that. It's just an overuse injury. There are other factors involved, but the two main points are too much training and too little rest between training sessions. So you're going to have to modify your activities if you start to feel symptoms, or if you are concerned about getting this condition. Prevention is the best thing. So you want to modify your activities, train a little bit less, doing whatever activity causes this condition, give yourself more rest, and perform more cross training. You can strengthen the opposing muscles. That will help with any type of overuse injury. If symptoms should occur, you want to start self-treatment and professional treatment immediately. Do not hesitate. If you wait, this condition can become chronic and disabling and prevent you from doing whatever activity that you want to do or need to do. Self-treatment includes modification of your activities, where you are training less, you are getting more rest, you are strengthening the opposing muscles, stretching the muscles that are injured. You can also perform self-muscle work on the muscles that are injured, and you also need to eat and use supplementation that works for you. Now is the time for the disclaimer. Please understand, watching this video does not take the place of seeing a medical professional. Please see a medical professional. Do not self-diagnose yourself. Seeing a medical professional will provide you an evaluation, a diagnosis, and a treatment plan to get you back to whatever activity that you want to do or need to do. Do not self-diagnose yourself. Get professional care. Get yourself as educated as you can to help yourself to prevent this injury and to prevent a recurrence of this injury. Seek professional care. As a doctor of chiropractic, lateral epicondylitis is a condition that I see in my office frequently. This is a condition, like we've been talking about, common in golfers, common in tennis players, common in weightlifters. Also, just through occupation, this injury can occur. So please see a doctor of chiropractic or another type of medical professional. As a doctor of chiropractic, I will evaluate the entire chain, meaning starting with the neck and the mid-back, going down into the shoulder blade, the shoulder, the upper arm, the elbow, the forearm, the wrist, and hand, to try to find the source of this condition or any other contributing factors that can be leading to this condition. And then the treatment will consist of the chiropractic adjustment, getting proper motion back to the spine and to the extremities, and restoring proper nerve flow to the area. The self-treatment strategies for lateral epicondylitis include static stretching of the wrist extensor muscles, isometric strengthening exercises of the wrist flexors and the wrist extensors, concentric and eccentric strengthening exercises of the wrist flexors and the wrist extensors, supination strengthening exercises. Supination is the motion of turning the forearm so the palm faces up, rotator cuff and scapular retractor strengthening exercises, tendon neuroplastic training, often abbreviated to TNT for the wrist extensors. I'm going to be making a video on that soon, so you'll be able to see that and learn how to do it. I will demonstrate it for the wrist extensors, and you could also perform self-muscle work on the wrist extensor muscles. When performing self-muscle work, you want to use mild pressure. Do not use moderate pressure. Do not use intense pressure. Mild pressure works best. And you want to perform this every other day. You don't want to do it every day. You want to perform it every other day. Again, use mild pressure. And this is after you have seen a medical professional get the correct diagnosis. The last thing I want you to do is to performing self-treatment on yourself that is incorrect and maybe causing further damage. But once you have been diagnosed with lateral epicondylitis, to perform self-treatment on yourself, what you want to do is, I'm going to be working on the right arm. You bring the right arm up so that the elbow is flexed, the forearm is supinated, and the wrist is flexed. And then you're going to take your finger from the opposite side and you are going to place pressure on the extensor muscles. Now, a good way to find where the extensor muscles are is you just extend the wrist, and you could feel that where it bulges up. That is the area where you want to start working. Now, you don't want to start on the bone, but you start at the lateral epicondyle, just distal to the lateral epicondyle. Again, with mild pressure, and you slowly extend the elbow, pronate the forearm, and extend the wrist. And then you hold that pressure and you come back to the starting position. Once you've reached the starting position, then you slide a little bit more distal on the muscle, keeping pressure on that point. Again, the starting position is the elbow flexed, the forearm is supinated, and the wrist is flexed. And you move into elbow extension, forearm pronation, and wrist extension. And then you come back to the starting position. Once you have reached the starting position, then you move to another spot that is more distal. Now, I'm going to turn a little bit so you can see better. So again, the elbow is flexed, the forearm is supinated, and the wrist is flexed. We're going to extend the elbow, pronate the forearm, and extend the wrist. And then return to the starting position. And you can do this all the way up the muscles, as far as you need to go. And it will help to reduce muscle tension in the forearm extensor muscles. Again, use mild pressure. Thanks for viewing today's episode of Dr. Ozello's Sports Medicine Report, where I covered lateral epicondylitis. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can see my blog and also have links to my social media pages. Please feel free to connect with me on social media. If you have any suggestions, feedback, or questions about this video, please leave them in the comments section below. Please remember to train hard, but train smart, and get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free, recover properly and completely from your injuries, and accomplish your goals.